Hello, everyone, and welcome to our 7investing podcast today. I'm 7investing founder and CEO Simon Erickson, here with my fellow colleague at 7investing, lead advisor Dana Abramovitz. Dana, thank you for being the guest on our 7investing podcast today.
Thank you for inviting me. This is fun.
It's such an opportunity to be here in Houston to hear your perspective on healthcare. I know that you spent your career in healthcare. You have a great perspective on this industry. It's also something we spend $4 trillion a year on every year. You just issued a special report for 7investing. It's all about the healthcare system and how can we fix some of the healthcare system. But my first question for you is, what's the status quo of healthcare in America today? What are some of the biggest pain points that we really need to be fixing out there?
Yeah, no, and I think that the current situation, with the pandemic, has really shed some light on some of those big pain points. The cost is just exorbitant. People don't know what they're paying for, which is part of the problem. Physicians are burnt out. They're spending all of their time updating medical records and not practicing medicine the way that they wanted to. And part of the problem is that people aren't taking care of their health to begin with, and so it's just this reactive process.
So let's talk about how we can fix something like that, right? We've got physician fee schedules, right? You pay for volume. We've kind of been seeing a break for that. We've seen value-based healthcare as kind of one of these topics we've been discussing. What does value-based care mean, and how can this maybe help some of the healthcare problems we're having?
Yeah, so value-based care transitions from that fee-for-service, that revolving door of, you go to the doctor and the doctor gets paid every time you visit them, so they have no incentive for doing something useful for you. Switches it to focusing on the patient and providing value for the patient, for the amount of spend that the patient is doing. So are they getting that quality of care, and then putting in place different checkpoints to make sure that value is being provided and met.
Mm-hmm. And how about the payers? Are insurers on board with this? This is very different than just reimbursing for a trip to the doctor.
Yes, absolutely. So a lot of this initiated from the Center for Medicare and Medicaid Services, mm-hmm. right? So the largest payer of healthcare in the United States is Medicare. And so, they're paying all this money, especially if, they're paying for a procedure and then 30 days, 90 days, the patient has to come back and have their procedure happen again, and then they're paying, so how do you fix that? So they are initiating a lot of the value-based care programs, and putting in those deterrents so that doctors and hospitals are accountable for making sure that the patient gets that value, that they're getting the care that they need, that the patient wants, and that all of the procedures are successful, right? Because otherwise Medicare is not going to pay for it.
Yeah. Now knowing that you've consulted in the healthcare industry for decades, mm-hmm. I mean, you've seen this industry evolve for a long time. Is this changing the mentality of companies and how they're approaching healthcare, knowing that it's not just pay for service, it's not just volume-based, we're kind of shifting in the way that things are getting paid for? Is that changing how companies are approaching hospitals?
Yes and no. And in part it's, hospitals are resistant to change, mm-hmm. right? I mean, like that's kind of part of the problem and the challenge with the healthcare industry and working with the healthcare industry is that they've been doing things a certain way. They have the Hippocratic Oath, first do no harm, right? And so if something's not broken, why change it, right? So it's really hard to see hospitals and healthcare systems overhaul their practice to do something, but slowly but surely that's starting to happen. And it's happening with different hospital systems are taking the initiatives. They're working with different insurers to create those contracts that say hey, if we don't do a good job, we're not going to get paid. We're going to be held accountable to that. And then there are a lot of companies that were created to kind of fit into this space to help those systems provide value-based care. And I think a lot of the telehealth component can be seen to be included in those types of discussions, just helping hospitals and health systems stay connected to patients, just to know and follow up and make sure that their patients are recovering the way that they're supposed to be.
So we're seeing a shift, and we've mentioned patients a couple of times there, but it seems like patients are becoming much more of the focal point, right? It's not just the administration, it's not just getting reimbursed and submitting the paperwork and all the systems that you have to do.
Yeah.
It's really more of a focus on the patient here. We're seeing a lot of what I guess you could call it consumer-based healthcare, right? It's not so much a patient that just has the data that's stored in the hospital. It's wearable devices. We're seeing people check smartphones, people getting more involved in their own health.
Absolutely.
How do you see this evolve?
Well, I think everybody's heard of Dr. Google, right?
Right.
Right. You get, whatever it is, and you Google it. And unfortunately, there's, a lot of new diseases that are coming as a result of that. But, I think that, patients are going in and having a conversation, after doing some research on their own and able to have a conversation and question their doctors. I think that it's gonna it might be generational. It might be what your specific background is and your experience with the healthcare system, to really question your physician or have that conversation with physicians. But I think that more and more people are taking that approach. And I think we're seeing that, from the physician end as well. There, like I had mentioned, physician burnout. So many doctors, went into medicine to practice medicine, to provide care, to help people, and with all the administration work that they have to do, and putting information to electronic health records, and just doing spending all this time documenting information, they get 10 minutes with a patient, and the rest of their time they're doing administrative work. What can they, how do we help that? So some physicians are changing their practice to a more concierge type of solution, so that they can be more involved and spend an hour or two talking to a patient, rather than the typical 10 or 15 minutes that they'll actually get paid for.
I don't want to do all the paperwork. I don't want to do all the electronic health records. I don't have to worry about the reimbursement. I just want to spend time with the patients and make sure that they're okay.
Yeah. And I think that there are patients that are willing to pay for that, or pay more out of pocket for that type of service, just because that's the type of care that they want.
The report that you wrote was called "Can Technology Fix American Healthcare?" Which I think is a great topic, because we're hearing so much about big tech companies really wanting to get into healthcare. Apple wants to get into healthcare. Google wants to get into healthcare. Seems like, and so many smaller tech companies too are really interested in this, probably because it's the next big frontier for them. Based on everything that we've just said, though, can technology really help healthcare, or is this just adding more complexity to an already very complex system?
Yeah, really good question. And unfortunately, the way I see it is, a lot of people from the outside, the technologists that if you're an entrepreneur, you're a technologist, you look for things to disrupt, right? I have this technology and I can disrupt something, right? Healthcare, everybody for decades we're talking about how the healthcare system is broken, right? So it's great for disruption, right? And you think, I have this technology, I can, help the healthcare system. The problem is from the outside, right? You can't just apply technology as a Band-Aid. It doesn't work, right? And I'm not just saying this. I mean, companies have proven it, right? They've tried and it's failed. And it's just because the technology isn't adopted. It's, it's not coming and growing from within the system to actually be created in a way that is usable by the system. And so I think that it fails in that way.
Technology will help, but it's not the cure-all for everything. It's much deeper than just a Band-Aid can cure you with.
Yes. Yeah. No, you have to work within the system in order to make that change and get full adoption.
Mm-hmm. Dana, you also have prescribed 7 potential solutions on how we maybe be able to help healthcare at least nudge in the right direction in your report. We won't go through all 7 of those. You need to read the special report that Dana wrote, which is fantastic for that. But what's maybe 1 or 2 that you're kind of excited about? What is a deeper fix for healthcare today? How can we fix this $4 trillion broken system that we've been trying for decades? Is there a couple things that we can at least have hope that things are going to get better out there for it?
Well, I think that the value-based care adoption, is great. Just really, the emphasis on the patients and, the supporting structure in order to enable that to happen. So there's this disconnect between, running a business and helping people. I mean, like I have that same problem, right? How do you do that? And I think that we've talked about some companies that are public benefit companies, right? So having a legal charter to not just have that fiduciary responsibility, but also to have responsibility to their customers, their employees, and society in general. And imagine, right, a pharmaceutical company that was a public benefit company, right? So instead of a $100,000 price tag for a drug, that can help a small number of people, right? Make that drug affordable to those people, right? And sure, that's going to affect, the bottom line of the company, but, I think that there are other benefits.
The metric isn't just financial always.
Exactly.
Yeah, and the system itself is getting smarter. It's more about focusing on patient outcomes. The metrics are changing.
Yeah.
It sounds like kind of an exciting time for healthcare right now.
I think so.
Well, really excited to have your perspective always with 7investing. Again, my guest, Dana Abramovitz, a lead advisor here at 7investing. You can always see her stock market recommendations every month, as well as her special report on Can Technology Fix American Healthcare, which is now available. Dana, this has been a lot of fun. Thanks for chatting with me.
Thank you.
And until next time, thanks for tuning in to our podcast for today. We're here to empower you to invest in your future. We are 7investing.